Well, welcome everyone. Thank you for joining our New Hampshire Cannabis Legalization Town Hall. My name is Ross Connolly. I'm the Northeast Regional State Director for Americans for Prosperity. We at AFP have been working on this issue many years, but there have been people advocating for legalization here in New Hampshire for decades and decades. And we have some of them with us today to provide their expert knowledge on the topic and hopefully rebut some of the arguments that we've heard from opponents. Because as we know, 70% of New Hampshire residents support legalization, and we're here to hopefully find that pathway to get this done for Granite Staters. So I just want to provide a little background on this year's proposal to start and how it came to be. So the bill number is HB 639. And it is a bill to legalize recreational cannabis for adult use and set up a regulatory framework for retail stores. And really how this came to be was after last year, 2022, we saw many different proposals to legalize cannabis, ranging from home grow to a bill to monopolize sales under the state of New Hampshire. So one of the reasons why our coalition came together was really surrounded on not if or when legalization was going to happen, but how it was going to happen, and finding consensus in the state legislature to get that done by addressing concerns from opponents. So over the summer, last summer, we all gathered together to really hash out those details and find this path forward. And the groups ranged from all over the political spectrum: the ACLU of New Hampshire, the Marijuana Policy Project, Americans for Prosperity, and the New Hampshire Cannabis Association, as well as the existing ATCs that are selling cannabis currently in New Hampshire for medical use. And really what we wanted to do was make sure that this was an accessible product to consumers, that it was a safe product for consumers. It was kept out of the hands of minors, but it also set up a free market system to make sure that Granite Staters can enter the field, the industry, if they wish to. And that process played out throughout the summer, and then we found sponsors for the bill after the election. So the HB 639 is sponsored by Representative Jason Osborne, who's the majority leader in the House of Representatives. And it's also co-sponsored by Representative Matt Wilhelm, who is the minority leader in the House of Representatives. So this was a common ground piece of legislation, bringing both sides of the political aisle together to find some good pathway to find a pathway to get good policy done for Granite Staters. So this year, it played out throughout the House. It passed the House twice. On the second vote, it received a veto-proof majority by the House of Representatives. Over 70% of the House voted for it, which is very fitting because over 70% of Granite Staters support the bill. It then moved to the Senate, where we always knew that was our biggest hurdle, was to make sure that we addressed senators' concerns. And we believe that we did address those concerns in HB 639. And it recently, just this past Tuesday, was voted on by the Senate Judiciary Committee. And unfortunately, they recommended the bill as inexpedient to legislate, which, if you're not familiar with the New Hampshire process, basically is a recommendation to kill the bill. Now, tomorrow, on Thursday, May 11th, it's going to be voted in front of the full Senate. So you still have time to make sure to contact your senator, encourage them to support HB 639, and overturn the committee recommendation to kill the bill. So with that brief introduction, I want to get to our panelists today, who are the real experts in this area. So to start, I want to introduce Dr. Nathan, who comes to us. Let me just get the bio up real quick. So Dr. Nathan is a psychiatrist and educator. He is best known as the founder and past president of Doctors for Cannabis Regulation, the premier national physicians association dedicated to the legalization and effective regulation of cannabis. He served as one of the several leaders of the successful campaign to pass legalization and regulation in the state of New Jersey, and has testified before the US House Judiciary Committee and in numerous states across the country. So thank you, Dr. Nathan, so much for joining us today. So just to start, I wanted to get your perspective on, as a physician, on why you support cannabis legalization from a public health perspective, and really what's the case to be made.
Absolutely. And thank you so much for having me. As you were saying, I'm the founder of Doctors for Cannabis Regulation, and it's not just me who I'm speaking for. It's a community of physicians. DFCR has hundreds of respected physician members in nearly every US state and territory, including New Hampshire. Our physicians include people like integrative medicine pioneer Andrew Weil, former Surgeon General Joycelyn Elders, retired clinical director of the Federal Substance Abuse and Mental Health Services Administration, Dr. Wesley Clark. As physicians, the group of us believe that cannabis should never have been made illegal for consenting adults. Why? Because it's less harmful for adults than alcohol and tobacco, and the prohibition has done far more damage to our society than the use of cannabis itself. Of course, cannabis is not harmless. For example, people who are predisposed to psychotic disorders should avoid cannabis use, and as with alcohol and other drugs, heavy cannabis use can adversely affect brain development in minors. But the prohibition of cannabis for adults does not prevent underage use nor limit its availability. For decades, preventive education has reduced the rates of alcohol and tobacco use by minors, and at the same time, underage cannabis use rose steadily despite its prohibition. Some have argued that if cannabis is legal for adults, then minors will think it's safe for them. But when cannabis is against the law for everyone, the government sends the message that cannabis is dangerous for everyone, and teenagers know that's not true. By creating a legal distinction between cannabis use by adults and minors, we actually teach our children a respect for scientific evidence and the sanctity of law. This may be why teen use has remained level or decreased in legalized states. Now, in 2023, even those who oppose legalization generally believe that cannabis should be decriminalized, and of course, in New Hampshire, it already is. But decriminalization is an inadequate substitute for legalization. In legalized states, government-licensed retailers check ID and only sell cannabis products to adults. But where cannabis is merely decriminalized, the point of sale remains in the hands of illegal dealers who sell cannabis, sometimes with more dangerous drugs, to children. Where cannabis is decriminalized, the government cannot regulate the production, the testing, or labeling of products, and that means that users consume an untested and potentially adulterated product of unknown unknown potency and quality. These are just a few of the many reasons to legalize and regulate cannabis. In the Q&A, I would like the people from the audience to ask me the hard questions, the questions that bother you or make you doubt the wisdom of passing legalization of cannabis for adults in New Hampshire. The questions, if you're a legislator, that keeps you up at night. I want to be sure to address those because I'm confident that when you get the totality of the evidence on cannabis and its health effects, then you'll understand why informed physicians may disagree about the specifics of good regulation, but we can no longer support a prohibition that has done so much damage to public health and personal liberty. We have to stop using a sledgehammer to kill a weed. So that's it for now. I'll stop here, and thank you, everyone.
Thank you so much, Dr. Nathan. It's always great to hear, a physician's perspective. I always like to get their perspective in most matters. So definitely appreciate you being here today. Next, we're going to move over to Rick Van Wickler. So Richard Van Wickler began his law enforcement career in 1987 and served as the superintendent of the Cheshire County Department of Corrections here in New Hampshire from 1993 to 2019. He was selected as Correctional Superintendent of the Year in 1997 and 2011. He also taught for 14 years as an adjunct professor at adjunct professor of American Corrections at Keene State College in New Hampshire. He currently serves as board chair of the nonprofit Law Enforcement Action Partnership. He has participated in discussions about international drug policy reform at the United Nations and has testified before the New Hampshire legislature on several occasions, including this year on HB 639. So thank you so much, Richard, for being with us today.
Thank you, and thank everybody for tuning in tonight.
So I just wanted to start by asking you, often we hear, the perspective from law enforcement as being the opponents, but I always say that it's not a monolithic profession, and many people have diverse views on, especially when it comes to the drug war and drug policy of how the United States and here in New Hampshire, how we should address those things. So I wanted to get your perspective of why you, from a law enforcement and a public safety perspective, support the legalization of cannabis for adults.
Thank you for that opportunity. And it's important to know that Law Enforcement Action Partnership consists of hundreds of police officers and people in the criminal justice system who agree with us and are advocates of legalization. We at the Law Enforcement Action Partnership, we have a vision that we can exist in a world with criminal justice reforms and marijuana policies that actually keep our communities safer. And our conclusions are based on our firsthand knowledge of the people that we deal with who have impacted us, in addition to how we might have impacted them. And that's how LEAP was founded and continues to grow in this effort. I've been speaking of marijuana legalization for the last 16 years, 13 of which I was a chief law enforcement officer on active duty. My interest and my passion for the legalization of marijuana for adult use in this discussion and any discussion about legalization is not only the impact on public safety, but it's also about civil rights, it's about human rights and the aspects of those laws and the responsible use of public resources. And of course, I consider it to be smart legislation based on facts and not myths. Detention jails from a public safety perspective has a primary purpose. And it includes the prevention of violence or flight from people who are detained there. The National Institute of Corrections and a lot of other credible criminal justice agencies that study corrections reveal that less than 10% of the population is at risk of violence or flight. Imagine that. And the pretrial population is oftentimes way larger than the sentenced population. And so we are trained, we're equipped, we have these massive, expensive buildings that are built to handle the most incorrigible and dangerous people in our society. But unfortunately, 90% of the rest of the people that are there in that prison population are subject to that same treatment as well. And that would include people that are there for nonviolent crimes, such as the use of marijuana. Early in my career, and several times thereafter, my responsibilities forced me to keep nonviolent, responsible adult users of marijuana in the same holding cell as people who committed homicide, rape, or extreme violence. And I always saw that as a truly terrible injustice in our society. When responsible adult users of marijuana are arrested, their lives are forever changed. And I've seen this time and time again. It's a fact that when one has a criminal record, they're going to struggle with work options, housing, getting credit, education, scholarships, so many other benefits that they should be entrusted with. And for a person of color, that hardship is compounded by a significant factor. The social harms and the negative societal impact associated with the substance of marijuana is just enormous. Consider in Colorado in 2011, before they legalized, they incarcerated over 39,000 people for marijuana offenses. And they legalized recreational use in 2014. And in that year, it dropped to just over 2,000 offenses. That means 37,000 people did not enter the criminal justice system and were spared a life of negative social impact, not to mention slowing down the hemorrhage of public resources for unnecessary detention and prosecution. In my 16 years of marijuana legalization advocacy, I've been extremely frustrated by the constant dialogue of prohibitionists whose key sources lack credibility and distort the truth on this issue. The Substance Abuse and Mental Health Services Administration in 2017, I think it was, they estimated that there's almost 20 million people in this country, 20 million people in this country that have used marijuana in the last 24 hours. Now, from my perspective, at that time, we had 2.6 million people behind bars and 7 million people in the correctional system. It's the largest in the world, one that everybody agrees is way too large, way too expensive to sustain. A marijuana prohibition model then suggests that we still have another 11 million nonviolent citizens to hunt down, convict, and incarcerate. And that just defies intelligence, in my view. Those that argue that marijuana spawns criminal behavior is vastly misinformed. It's the prohibition aspect of marijuana that permits the illegal activity, as the doctor said earlier, and violence to exist and prevail, while regulated marijuana products are a much safer alternative to alcohol and tobacco, which was already stated. Those that suggest that New Hampshire is no longer incarcerating people who smoke marijuana, I've heard this many times. The fact is, we're still incarcerating about 1,000 people a year for this reason. That's 1,000 lives that are going to have a negative societal and governmental cost, a significant negative impact. The fact is, adult users of marijuana truly prefer a legal system to patronize, one that's known to have a safe and a clean product, the content of which is known at the time of purchase and meets established guidelines. Everybody wants that. Responsible adults prefer a system that prevents easy access to minors. And a responsible government that is truly concerned with public safety should recognize and honor these facts. Thank you.
Well, thank you so much, Rick, and thanks for everything you do and LEAP does. It's really great to hear your perspective, coming from a public safety background. It's one of the cases we make at AFP all the time that we're not saying cannabis is good for you. We're saying the collateral consequences associated with prohibition completely outweigh any of the potential impacts from legalization. So thank you again so much, and we'll get back to you with questions later. But I want to shoot over to Barbara Broll. And she's comes to us from Colorado. Barbara served as Colorado's Director of Revenue from 2011 to 2017, leading a team that regulates over 2,000 liquor and cannabis businesses, along with the lottery and gaming industry. She was responsible for implementing the first in the world regulatory program for legalization and regulation of cannabis for adult use. Barb is an expert in marijuana regulation, probably one of the preeminent experts in marijuana regulation. And after Colorado voters approved legalization in 2012, Barb was appointed by then Governor Hickenlooper to co-chair the task force implementing the constitutional amendment. Barb also helped to develop legislation and rules around regulatory and enforcement matters. She has consulted with governments on both national and international levels to present the Colorado model. And thank you so much for joining us, Barb, and thank you so much for creating that Colorado model that has created this great positive snowball effect that's happening across the country. So I wanted to sort of defer to you on that your expertise and discuss what legalization and regulation looks like in Colorado and what that Colorado model really has done and what the impact has been in your state.
Well, thank you. Thank you for having me on. And the first thing I want to say is I had a phenomenal team that worked pretty much around the clock to get this done in the short time that we had to do it. So it was definitely a team effort. But when you're the first in the world to do something and you have nothing to model yourself after, you have to figure out what are going to be your guideposts. And we had 3 of them. We decided that what we needed to do was keep marijuana, keep cannabis out of the hands of kids. We decided we had to keep it out of the hands of cartels and actual criminals, not those that just happen to be caught using or a little bit of dealing. And we also wanted to make sure that we could keep the regulated marijuana out of other states. And actually, we were pretty successful with all those 3 things. With regard to children, we had incredible rules around age restrictions. You have to show your ID 2 or 3 times before you can even walk into a medical or a recreational facility. You can take your kid into a liquor store and buy vodka, but you certainly can't take them into a dispensary. So that was a really big deal. And we had underage operatives making sure of that. In addition, we talked with parents, made sure that we were addressing things like everyone talked about the gummy bears and how these were enticing to children. We talked with folks like that, and we addressed issues around that. And the other thing was we addressed things like when and how could advertising occur. And so those were the things that we put in place for children. And we were actually quite successful. As has been said earlier, youth use has not gone up. It's actually gone down. Number 1. Number 2, we have a higher incidence of graduation rates, and we've had a lower incidence of dropout rates. And so it's not impacting their educational system. Now, nobody wants kids to consume. And not a regulator, and actually none of the business environment does either. They know what that is, what that will mean to them, and they have helped with that as well in Colorado. The second thing, keeping it out of the hands of cartels and actual criminals, we implemented a really robust licensing system, lots of background checks, making sure that we checked financials, a number of things. And also, there was an enforcement component. So periodically, you'd go in and do a tax audit, periodically go in and do an enforcement audit and make sure that they were actually adhering to the rules and regulations. We had great success with the industry because what we did is we created something that we called negotiated rulemaking. And what we did was bring them in and say, here's an issue, here's something we need to do. Help us solve this. What would you do? And the truth is they came in with solutions and with attitudes of I want to make this work, because they knew that the world was looking to see how Colorado was implementing this and whether it was going to work or not. And they knew that it was very strictly scrutinized. And then the last thing of keeping it out of other states. Well, one of the things I will tell you is this. We early on conducted a demand study. We had an external organization conduct that demand study, figure out what was going to be the demand for Colorado consumers and some portion of tourists, cannabis tourists that would come into the state. And what we found is that people really would prefer to purchase from a legal environment. We mapped that demand to the actual sale. And what we started to find was in about 2017, 2018, we were already satisfying 100% of the Colorado demand through the regulated market. And what that says is that given a choice, people would rather go into a place that's lit, that is legal, that is clean, that the cannabis is tested. They know that it's safe. They know that what the dosage is. They understand what they're getting. And if something does go wrong, it can be recalled. And so they prefer that sort of thing. They even prefer that they pay taxes and that their tax money goes to address regulatory issues and regulatory systems and homeless issues and substance abuse issues and things like that. Where we are finding, and there is a black market in Colorado still, is it's sourced in Colorado to go out of state. And I'm just going to say this, and it may not be very politically correct, but I'm going to say it anyway. As long as there are states that are prohibiting this, there will be some enterprising organization or person that will attempt to grow somewhere, ship out of state, and satisfy demand in that state. So if you really want to eradicate the black market, legalize federally and legalize across all the country, all the states.
Thank you so much for that, Barb. And that's one of the constant arguments we get is the example from Colorado. Oh, you didn't eliminate the black market, and we always say, well, it's because it was exported. That's one of the prime reasons. And New Hampshire, one of our arguments constantly is just trying to get legislators to understand the reality that we're in. That anyone in the state of New Hampshire who is an adult who wants to buy and consume cannabis is already doing so. They're just going to Massachusetts, Maine, or Vermont and coming back. And it's just an unsustainable situation. So thank you so much for providing all your expertise. And we'll definitely come back to you for questions later. I'm sure the audience will have some for you, but I want to shift over to Karen O'Keefe. So pull up Karen's bio here. She manages the grassroots and direct lobbying efforts in state legislatures for the nation's largest cannabis policy reform organization, the Marijuana Policy Project. Karen is an attorney who's been with MPP since 2003. And is perhaps the foremost expert on states' cannabis policies, working closely with local advocates and lawmakers. Her team has played a leading role in passing more than 20 medical cannabis decriminalization and legalization laws, including New Hampshire's medical cannabis and decriminalization laws. So thank you so much, Karen, for all the work you've done and all the help you continue to provide New Hampshire. So I sort of want to walk through the personal liberty provisions of HB 639, and then sort of your take on the regulatory tax structure. What are the unique bits of this bill, since you were so critical in helping craft this legislation?
Sure. So we've got the kind of snapshot up here. In short, any adult 21 or older, if this passed, would be allowed to possess up to 4 ounces of cannabis and specific amounts of concentrates and THC within infused products such as edibles. The law does not include any protections from private employers punishing a person, but there are some legal protections, including if a person's employed by a state or local government, there are some employment protections. And it also includes protections from having your life ruined for cannabis use in things like child custody, if you need an organ transplant, government benefits, and professional licensing, as long as, for example, for organ transplants, there's not an actual clinical reason for doing it, but it can't be just merely discriminating against somebody for being a cannabis consumer. The bill would also mean that anyone who had a pending charge for any of these quantities of cannabis would have it immediately dismissed. There are some limits. We work together with other advocates, and the initial language of the bill did include home cultivation. It's been a compromise process through committees that was removed. It also would continue to make it illegal to use cannabis in public, as is the case in almost every legalization state. Anywhere that you can't smoke or vape tobacco, you also couldn't smoke or vape cannabis. And if someone was in a moving vehicle, they also couldn't smoke or use cannabis there. But it's a huge step forward from current decriminalization, which covers up to 3/4 of an ounce and has a civil penalty. And beyond that, you can actually still go to jail under existing law. So turning to the licensing provision, I'd say that this is the most free market of any of the state laws to if it were to pass through the legislative process. Some of the ballot measures were more free market, but usually the bills that have passed through state legislatures have very limited licensing processes where you need a lot of money to even throw your hat in the ring. You often have to own property up front, and there's a scored system that you need to be very connected. In this case, anyone who applies for a license would be able to get issued a license if they qualify, if they meet all the requirements, if they pay the fees, which are low, which must be reasonable, and if they comply with any reasonable local zoning regulations. And cities could also have bans if they wanted to on businesses locally or set numbers locally. But there's no statewide cap on the number of licenses, much like any other business isn't capped. On taxes and revenue, it would have one of the lowest, if not the lowest tax rate in the country. 12.5% would be levied on wholesale sales, so it would be much lower for when you're looking at what the consumer's buying. And the revenue would be distributed for a number of state needs. This has been revised through the committee process, but half of it would go to the education fund to basically reduce property taxes, 30% to pension liabilities, and then a total of 20% to various substance abuse type concerns. Now, moving to public health, there was a lot of input from a substance abuse group called New Futures. In the details of the bill, they haven't endorsed it, but there was a real concerted effort to address a lot of their concerns. So as is the case with a lot of other regulatory laws for cannabis, you have lab testing to make sure people know how potent it is, to make sure there are no contaminants. Regulators would come up with health and safety regulations. All cannabis would have to be sold in child-proof packaging. It couldn't appeal to minors. There would be lots of advertising restrictions. There would also be buffers between cannabis businesses and schools and preschools. And you'd get something whenever you bought cannabis that would be much like what you get with a prescription. A lot of the concerns opponents have, we think, could be best addressed by education. So you would have scientifically accurate information to consumers about any risks of cannabis, including specific types. And regulators could also require posters, about the risk of DUI and anything else they think needs to be told to consumers. And it also would dedicate 10% of the funds, which now anybody from New Hampshire buying cannabis, gives money to tax revenue in other states. Instead, 10% could be used actually for treatment and recovery and education within New Hampshire itself.
Thank you so much, Karen, and for everything you and MPP do here and across the country. You've been integral in really getting these laws passed across the country, and really finding this common ground bill that we did compromise quite a bit on to try and get it done. And there's still a shot tomorrow if you talk to your senator tonight and encourage them to overturn the committee recommendation. But no matter what, I'll just say, just looking at some of the comments in the chat, no matter what, we are going to keep up the fight for cannabis legalization in New Hampshire, because this situation, the status quo, cannot continue. It is impossible for us to keep going down this road that where we're in this gray area of legalization. So thank you again, Karen, and we'll definitely come back to you for questions later. But I want to introduce our final panelist today. Dr. Riley Kirk is a natural products chemist, a cannabis consumer, educator, and advisory board member for the New Hampshire Cannabis Association. With nearly 500,000 followers on TikTok, she's educating and gathering information from consumers to improve our understanding about cannabis pharmacology. She has created hundreds of videos that cover topics including how cannabis works on the body, mental health issues, edibles, opiate substitution, Delta-8, terpenes, and much more. Dr. Kirk also co-hosts a podcast called Smokin' Science. I love the name, where you can get a deeper dive into cannabis science. So thank you so much, Dr. Kirk, for joining us today. And I just want to get your perspective from a local on the aspects of HB 639 and legalization and regulation in general, and what you're most excited about as a cannabis science and educator, and what's happening in the cannabis world right now.
Absolutely. And thank you for having me on this panel. I feel honored to be among these other speakers that are so educated on these subjects. I think what I'm most excited about with cannabis legalization in general across the country is enhancing our research on these subjects. We have been extremely limited over the years on research with cannabis because of legalization issues. But specifically in New Hampshire, I'm just very excited to see people have access to this medicine. As so many other people are saying, the limitation and the prohibition of cannabis in the state is not stopping people from using cannabis products. I am a consumer of cannabis products as well. It is just limiting the people who can actually get the products and how easy it is for them to get the products because they have to travel to these neighboring states. And as others are saying too, it's also just enhancing the illicit market. And as someone who's worked in testing laboratories, as a chemist with cannabis products, there can be unsafe products on the market, and testing is definitely required, especially for people who are immunocompromised. We need to make sure there's no mold or residual solvents in these products. And legalization is a great way for harm reduction to make sure that these products aren't reaching the people. Cannabis legalization can also help people, even from a non-medical standpoint, help them use alternative medicines to pharmaceuticals and to even opioids, heroin being one of them, et cetera. These issues that have been really wreaking havoc in our state and causing so much damage, where we know that when we compare the toxicity or the health standards of cannabis to even something like nicotine or alcohol, it's pretty clear that the science does not support prohibition of cannabis. It's a very safe compound or drug compared to the other ones that we're talking about. And if we really were trying to look after just the safety of everyone, then none of these products would be available to people, because cannabis has never killed someone. But we see the alcohol and the nicotine and tobacco, constantly causing adverse health benefits or effects to people in the state. So I think I'm very excited just to see people have access to the products that they've already been using, but to spend that money in New Hampshire and for us to use that money to better our state in so many ways. People want to support the New Hampshire industry. And I know of people that are leaving the state to go support other industries, not just buying products, but also working in other industries. We've had very talented chemists and doctors leave this state to go to neighboring states because we don't have a legal industry. And that's really, really sad to watch. So I'm really excited to have those people come back to New Hampshire, hopefully, and start this thriving industry in this state.
Well, thank you so much, Riley. And big shout out to the New Hampshire Cannabis Association. If you're not familiar with them, look them up. They are doing great work. They're made up of a lot of cannabis industry professionals who work in the cannabis industry, just not in New Hampshire. And that's because of our current laws. The biggest irony in the world is that a lot of the arguments from opponents it has to do with driving. And I know we're going to get to that question eventually, but driving and the effects of driving on cannabis. And the biggest irony is that we're telling people to drive to Massachusetts and Maine and Vermont to pick up their legal cannabis and drive it back to their home in New Hampshire. So if anything, it only harms public safety, the current status, and we're not contributing any sort of funding towards identifying those people that are on the roads right now, since we're in this quasi-legal state. So thank you so much, Dr. Kirk, and I'm sure we'll get back to you later, but we're going to shift now to our round robin of panel questions. So I wanted to first jump back to Rick Van Wickler. Since you're such an expert on sort of the public safety aspect. So I wanted to sort of have you address some of the arguments from opponents. So some say that we need legalization because we already have decriminalization and cannabis consumers aren't going to jail. How would you respond to that? I know you addressed it in your initial comments, but this argument that we're not sending people to jail, people aren't getting punished, there's no negative effects of the current situation.
Well, in fact, there is. when you have decriminalization, you still have the illegal entity, the illegal black market in your community. Marijuana use is not going to go away. So if we say as a society, okay, we're not going to incarcerate people for this practice, well, why aren't we going to deal with the crime that is occurring in our community with respect to illegal dealers that are selling substances that may be tainted that could create public harm? So if we're really concerned about public safety, legalization is the true and only answer to get that done. Decriminalization, you don't put people in jail. And by the way, places that have decriminalization still oftentimes have an opportunity to issue fines in some cases. So fine, you're not going to jail, but it doesn't solve the problem of crime, which grows. There becomes turf wars. The Drug Enforcement Agency said that 60% of all of the gang violence that occurs is over turf war disputes, right? Who's controlling the marketplace? And so decriminalization, on the one hand, okay, you're not putting people in jail, but on the other hand, you have a vast enterprise that's not regulated, not taxed, not safe, that might start out as people who are business opportunists but have no choice but to get involved in crime to protect their product and their turf. Decriminalization is bad.
And from your perspective, I'm just interested in this sort of dynamic. Since in New Hampshire, we do sell alcohol through the state on the side of our highways sometimes, and that dynamic of having a legal store where you're ID'd compared to the current status in New Hampshire where you go to an illicit dealer. We often hear from people in schools, high schools, things like that, that cannabis is everywhere. From your perspective as in law enforcement, was accessing alcohol in the current system easier to get for a minor or more difficult to get than cannabis products?
Well, studies are clear that alcohol is much harder to get than marijuana is for our youth. And I'm sorry, but every time I see one of those signs that are within 1,000 feet of a school, drug prohibition, so you kind of chuckle inside. I'm like, do you know how much marijuana is probably in there? I had a discussion with a police officer one time who insisted that we wouldn't have any of these problems if we just got very, very harsh on the dealers. We got to define, make some really, really stiff and hard laws for dealers. And I said to him, listen, you have to be careful because a lot of the dealers that would meet that definition are high school students. And some people are over the age of 18 and still in high school. A lot of these are the facts. And how does that happen? It happens because you have an unregulated market. There's no regulation.
Thank you so much for that, because it's a constant argument that we hear, and we at AFP and all the other groups supporting this bill have constantly made that point. If you just do the research and maybe visit one of the stores in Massachusetts or Maine or any of the legal states, you're carded, you're ID'd at least multiple times just getting through the door. And to Barb's earlier point, there's no minors that are even allowed in the building. So thank you so much for that, Rick. And I'm sure, the audience will have some questions for you later. So we'll get back to you. But I want to shift back to Riley to really address some of the claims that legalization just isn't necessary right now, that you can get it, you can go to Massachusetts, what's the problem? It's not a big deal. So what would you say to someone claiming that legalization isn't necessary, and that adults who want to access cannabis can just sign up for New Hampshire's medical program? We already have medical marijuana, we have decriminalization. Why do we need legalization?
I think one of the most important topics to mention here is it's not that easy to get a medical card, and a lot of people don't have a qualifying condition that would make them eligible to get a medical card. And of course, you could lie and go through that, etc. But a lot of people don't want to do that. They're honest people. And I've had actually a few family members go through this process, and it is a very difficult process to get a medical card. And once you get one, that's great. But there are also just limited dispensaries in this state as well. I live in Coos County, the North Country, and you would still need to travel quite far to reach a medical cannabis dispensary in the state of New Hampshire. So it's still really not accessible even for people who live up north here. So we really need to have more dispensaries. Even if it was recreational, that would be ideal throughout the entire state to make it more accessible. And as you had mentioned before, we need we need recreational cannabis because people are using it, but they're driving so far to other states to get these products. And that's just really not practical. I think there's a lot of conditions that have been researched for medical purposes, but they might not be a qualifying condition. Like the data might be there, but it might not be listed as a qualifying condition in this state. So for those people where we know we have evidence that cannabis can help them with the symptomology and managing the symptoms of their condition, we know that it could help, but it's not a condition, so they're not eligible for a medical card. So for a lot of those people, they still want to use cannabis, and this could be both mental or physical health. You could also go through times in your life where it kind of ebbs and flows, specifically talking about mental health, and you might not always qualify for a medical card, but sometimes you might and sometimes you might not. And you might go through periods where you need access to that medicine, and it's really kind of unpredictable. So I think for a million reasons, because it is safe, it's a very safe product. It's great for mental and physical health. We have a ton of research on it. And I will also say to our senators that are still against this bill, I understand it's not all of their fault that they feel adversely to this bill, because that specific population of people has been exposed to so much propaganda saying that cannabis is bad for everything. It's going to make you stupid. It's going to make you lazy. And that is not the case. But these people were subjected to that propaganda throughout their life. And I think it's time that we start really listening to the science and the research and try to reverse what our previous conceptions of cannabis are, because it does produce functioning members of society. It is a method of harm reduction away from stronger drugs and pharmaceuticals that people do not want to be on, but do not have access to alternatives.
Yeah, and I just want to touch on a couple points you made. You know, the last one is one we focus on all the time, is that the one of the only demographics that I've found that actually increases in use once legalization occurs is those 65 and over, so the senior population. And it's often to get them, it is a better alternative than the opioids that they're prescribed that have enormously negative side effects. And they find that having edibles, having, you know, access to safe cannabis is a much better outcome. And on the medical front, if people aren't familiar with the New Hampshire medical cannabis system, it's very limited. And this is why we at AFP advocate so strongly for robust free market competition, because you have to lower the price. And I know just anecdotally from medical patients who are cancer patients, who are driving to Maine to go get their cannabis, even though they have a medical card in New Hampshire, because the cost is just exorbitantly expensive. And they would prefer, and some of the products there might be more accessible and diverse as well. So thank you so much, Dr. Kirk, again, for coming on and giving your perspective. I want to shift to back to Dr. Nathan and having that perspective from the medical field, because there's been so many arguments from opponents on negative health impacts and different psychological issues things around that. So I want to sort of touch on, there was a study that found that most adult use consumers in Denver use cannabis as an over-the-counter sleep aid or for pain. How do cannabis risks compare to those of other commonly used drugs for pain and sleep? It's one of the most frequently frequent uses of cannabis. So I just wanted to have you touch on that issue. Oh, you're on mute, doctor.
Of course I am. So thank you. Great question. You know, it's really an apples and oranges comparison, and we can do apples and orange comparisons if you can do a study that prospectively looks at the difference between apples and oranges. And we don't have that. Whether it's an over-the-counter sleep aid, a prescription sleep aid that might actually itself be a controlled substance, versus cannabis that, you know, shouldn't be in the Controlled Substance Act at all, but is actually a Schedule I substance, compared to things like benzodiazepines or Ambien that can lead to sleepwalking, sleep driving. That's Schedule IV. So whether you're talking about a Schedule IV substance or you're talking about Benadryl that you can get over the counter, there are pros and cons to all of these options. So Benadryl will kind of dry you out, but it's very easy to get and it's inexpensive. Ativan, Ambien, Xanax, those things are addictive, much more so than cannabis is. And you may find that you have better sleep with one choice or another, but choice is the key word here, that it boggles the imagination and defies reason to think that while we have drugs like, you know, benzodiazepines like Valium out there, and those are legal for doctors to prescribe, and people can go to the store and buy something like Benadryl, which is actually dangerous in overdose. And yet we choose not to even regulate this plant so that the people who are already using it, and like we were saying earlier, tens of millions of Americans are using it. So either they're all criminals or the laws are just wrong. And for those tens of millions of Americans, why would we not want a regulated product that people could know exactly how much they're getting? So I would say that cannabis off the street is potentially fraught as a sleep aid or a treatment for pain. But the real issue with it is getting cannabis from an unknown source is essentially like somebody handing you a bottle of liquid and saying, this is alcohol. They don't tell you if it's a hard seltzer or Everclear or vodka, but here you go. It's a terrible idea. We would never do that as a society, and yet that's what we do with cannabis. And actually, let me touch on the issue of pain a little bit. Because what we find is that in states with legal medical cannabis, the use or the prescriptions for opioids, the rate of opioid addiction, those numbers actually go down, and it's pretty clear that people are substituting one for the other. And when adult use is added to the mix, it goes down even further. Now, how could that be? I think Riley was talking a little bit about the distinction between adult use and medical cannabis. You might think that, well, if you're really using it for a medical purpose, then all we need is legalization of medical. But that's not true, because there is a study actually that was done by one of the DFCR experts and spokespeople, Julia Arnston, who surveyed people coming out of adult use dispensaries in legalized states and found that when she asked people, the majority of them said that they were using cannabis for some kind of medical purpose. So even if you think that cannabis has not a single use or a single verifiable purpose in medical use, which is a ridiculous proposition because the data is actually quite clear on some of these indications. But even if you think that it's not a great idea, it still should be regulated so that the people who are already making that choice and choosing to do so, whether or not it's regulated, will at least get a safer supply.
Thanks for that. And one of the issues that always comes up, the most famous prohibition of all was the prohibition of alcohol, which is one of the most deadly drugs in the world when you look at the amount of people that actually die or have negative health consequences from it. But everyone acknowledges that prohibition of alcohol was one of the greatest policy failures of all time. It resulted in the highest murder rates in the nation's history, and just endless problems. So I want to have you touch on, the comparison of the health risks between alcohol, which is widely used culturally across the country, and the risks of cannabis to your health.
Sure. I mean, really, it's again an apples and oranges comparison. The fundamental difference is alcohol can kill you and marijuana cannot. So there's really a world of difference when you think about public safety and both products. So we can be quite confident in saying that alcohol is more dangerous in adult use than cannabis is, because by just about any measure, whether you're looking at longevity, whether you're looking at domestic violence or crime, other kinds of crime committed while under the influence, drunk driving is so much worse than driving under the influence of cannabis. For adults, it's not a close call. It is a no-brainer. I will say, and this is something I always want to do because I'm a physician first and an advocate second, and that is to make that distinction between adult use and underage non-medical use. There are some minors who have to take cannabis for medical reasons, and that's fine. But the non-medical use of cannabis just carries too many risks in younger people, and we don't know how the two would actually compare in long-term use. Of course, most people that try alcohol and try cannabis when they are young don't have problems with either of them. But the risk is higher for the use of any drug, whether it's alcohol, tobacco, cannabis, or anything else, if you start it when you're young. So for adults, there's no comparison. The thing that really got me into this whole world when I was in medical school was the obvious difference between the lethality and the harms of alcohol and the harms of cannabis. And one was legal because it's somehow impractical to keep it illegal, and the other one is illegal. It bothered me so much that it eventually led me into the world of advocacy around this, because it is just not a close call between those two.
Well, thank you so much for clarifying that point. It's one of the constant ones we hear, and as somebody that struggled with alcohol and quit entirely 5 years ago, it's one of those that really annoys me personally the most. And I'm not ever advocating that alcohol should be prohibited, but regulated and alcohol has obviously been more successful than prohibition. So thank you so much, Doctor. I do want to jump back to Barb to address some of the issues we hear constantly. One of the opponents' claims we always hear is around youth use. We heard it during testimony in the Senate hearing from kids that showed up and said it's everywhere in their schools, which I found very ironic, since it is currently illegal in New Hampshire. So opponents, like I mentioned, suggest that legalization endangers youth. What does the data show from your experience, Barb, regarding rates of teen use in Colorado or across the country, and teens getting access to cannabis both before and then after legalization?
Thanks. Actually, there are several studies that have been done. In Colorado, we have the Colorado Kids Healthy Survey. There are also the NSDA, and just recently the CDC came out with one as well. And in all of these studies, it has shown that across the board, there's either the same usage or it's gone down. And one of those, like I said, was done by the state of Colorado, but the other two are done by national organizations that have no vested interest in what the outcome is. They just want to really report on what the actual data shows. And one of the things that we have found, like I said, in Colorado with the Healthy Kids Colorado survey is that, and that's one where we can see, we go out and study children over a kind of a biennial perspective. Every 2 years, this report goes out. It asks them questions about anything from their sexual history, sexual habits, eating habits, bullying, alcohol usage, tobacco usage, as well as marijuana usage, cannabis usage. And what we're finding is that cannabis usage is, for the most part, stayed either the same or has gone down. There have been a couple of times when it's gone up in a little bit of a different way. And so we've addressed those issues. But for the most part, it's been completely, there's not been any real significant change. In addition, the like I said, NSDA, the same sort of thing, the kinds of reporting that it has done and the surveys that it has done has shown that it has not gone up either. You know, the other area, like I said, a really recent one was just a couple of weeks ago at the beginning of May, where the CDC issued a report on its youth risk behavior survey, and it said the very same thing. And so the truth of the matter is that I don't know whether why kids are saying that. I have heard that myself. I've also heard it from law enforcement that has said it is everywhere. It is all over the place. It's constant. And when I ask questions, I'm a lawyer, and so when I ask things like, okay, what's the evidence? How much has it gone up? How have you identified where it's coming from? You know, there's not a lot of evidentiary based information that comes out of that. I'm not saying that it doesn't feel like that, because I'm sure if it's your child that is using cannabis, you feel it's everywhere. So it's all a very relative kind of thing. However, when you look at it from the perspective of facts and data, the studies just don't support that. In addition, as I said earlier, we've been looking at graduation rates and dropout rates, because that's an indication as well. If kids are using, generally they will probably not do as well in school as they could, for all of the obvious reasons. And what we're seeing is that's not the case either. It actually has gone up, the graduation rates, and it's been pretty significant. Let me see if I can find the numbers for you, because I think that's a really important thing to see. Okay, here it is. The graduation rates have risen steadily from a 10-year low point of 72% in 2009 to 2010 to almost 82% in the 2019 to 2020 school year. And like I said, those are an every 2-year study. At the same time, dropout rates decreased from 3.1% to 1.8%. So, I mean, the numbers just aren't supporting the allegations with regard to that.
Thank you so much. I mean, it's always important to have that real world data instead of sort of the anecdotes we get from people, you know, in testimony. Having that evidence is always good to show. I just want to ask you one more thing. I'm generally interested, since you were the first one to really, you know, you were the pioneer to really set up the first system. What is a suggestion that you would have for any state, you know, in the regulatory policy? You know, what's one suggestion you'd have for states that are considering legalization, and when they're going about setting up a regulatory framework?
Well, I have to tell you that when this whole thing started in Colorado, and I was the one that was through the amendment chosen to do the rollout because I was the executive director of the Department of Revenue. One of my sons said to me, "I cannot believe, Mom, out of all the people in the state of Colorado, you were the one that was chosen to do this," because I was always such a prohibitionist. No, 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 there's never anything you can, it's this horrible thing. Doesn't matter whether you're an adult or a child or anything. I will tell you that what I would suggest are two things. Number one, really looking at the facts and data, number one, because what we're finding was there were lots of information. This is what's happening. This is where it's happening. All the interdiction of happening that there was, cannabis going across the state lines, and everyone was saying that it was coming from a dispensary or from a store. Well, if you or they asked students, and students said, "Oh yeah, I walked in and bought some." Well, if you're a kid and you are caught and you're going to be asked the question, "Where did you get it?" Are you going to tell your parents that you got it from your friend or your older brother? Or are you going to tell them you went into a dispensary? I mean, let's think about this realistically. So the first thing I would say is really ask some hard questions and ask for the data that's behind that and the reports that are behind it, because there's a lot of them out there. And then try to figure out what's the incentive for someone to allege those kinds of things. But the other thing that I would say is, if you're thinking of legalizing, gather facts and data now. Understand what your emergency room rates are. Understand what your DUI rates are. Understand what the usage rates are. Because what will end up happening is that as you start to after legalization, as you start to report on these things, you can't tell whether or not it's increased or if the data is different because, number one, people are now more comfortable reporting. So if I have a negative experience, okay, I'm okay going to the emergency room. Or DUIs. It's so much easier to check for alcohol usage impairment. And so if what was happening was law enforcement was very, they're out on the field, they don't have a lot of time. If I can check for alcohol usage and you fail the test, it doesn't matter whether it's alcohol or marijuana. But when we started to say you have to stratify the data, suddenly it looked like, okay, there's like, some small percentage to now is this huge percentage. So the thing I would tell them is understand the data, understand who you're talking to, understand what everybody's bias is, because everybody has one. And the second thing is to start gathering the data that you're going to want to base future policy decisions on. The other thing is build a program that has a continuous improvement process built in, because it allows you to keep going in and tweaking it as you need to. And you will need to, because nobody is going to get it right completely 100% the first time. So do what you can, do that 80-20 rule or whatever it is, and understand that what you're really doing is reducing harm. And harm reduction to me is the most important thing. The Global Commission on Drug Policy issued a report a few years ago that I had some input into. And one of the things they did is they had kind of a U diagram in there. And they showed that the harm that society and individuals experience is the same for when it's completely prohibited and when there's unfettered access. The only time harm goes down for society and individuals is when you have a reasonable, robust regulatory system. And that is really the key thing.
Yeah, I thank you so much for all that information. I mean, one of the things, it's interesting you're a prohibitionist. You were a prohibitionist. Not anymore, obviously, but you were. I always say to the legislators that, to keep an open mind, because the ones I'm most proud of and proud to work with are those that did change their position. They saw the light, they saw the situation that we're in and realized that we have to make a change. So I really appreciated that point. So thank you so much, Barb. Your expertise was incredibly valuable. I want to jump back to Karen to go over some of the more details of some of the other proposals. Obviously, last year, we famously had, I think Oregon was the only other state in the country that tinkered with the idea of having state-run stores, so state stores selling cannabis to consumers. I know Oregon never followed through with that, and the bill last year did not happen. But I'd like to get your perspective just on how that state store model would work or would not work, or just MPP's sort of POV on it.
My suspicion is that if a law passed to have the state commit federal felonies and sell cannabis, it would just never happen. So what you probably would see is the state spending $10 million to start buying stores. If they got that far, they would be licensing private growers and private producers. So those people would invest a lot of money to sell to these state stores. But at the end of the day, I don't think they're really going to have the state commit a bunch of federal felonies. And it's not because I think the federal government is going to go raid them. They're not doing that with private businesses. But we're a nonprofit advocacy organization, and we've already encountered so many problems because of cannabis's illegality. You know, trouble getting retirement accounts, trouble getting banks dumping us. There's immigration issues. Private employees for MPP have had trouble getting mortgages. So there's all of this stuff that makes life so difficult because cannabis is illegal. And then you also have the issue that the legal issue for a state regulating private stores versus the state itself selling cannabis is very different. And if anybody went to court, it would basically be preempted and thrown out. So I think you'd just see a boondoggle, basically, people wasting money for nothing.
Yeah, and that's, you know, one of our takes too, and it obviously bumps up with the federal policy. And I'll point out, we at Americans for Prosperity, I know MPP as well has been advocating for changes at the federal level for quite some time. You know, that you mentioned the banking issue, you know, having the Safe Banking Act passed at the federal level would at least give some relief to the probably hundreds of thousands of people that work in the cannabis industry currently across the country. But I just want to see, you know, what your take from MPP is on the federal level, what the federal government is doing or maybe not doing to actually change these laws to make it easier for states who decide to legalize cannabis, for them to operate in their home states.
Yeah, about 5 years ago, I used to say I thought federal legalization was coming in about 5 years, and I have stopped predicting when it will come because I was wrong, and I'm not seeing it in the immediate horizon. You know, there was a non-enforcement memo under President Obama. Before then, and even during part of Obama's term, there were people that were arrested and prosecuted, including people I know, for doing state legal cannabis activity. So that does create some space. But there's still huge federal tax penalties because you can't deduct business expenses for cannabis. Banks, it's technically money laundering for banks to do business with cannabis. A treasury note says, if you fill out the suspicious activities form, then we probably won't prosecute you. But that adds a ton of fees. They're essentially just like vaults. You don't have normal banking services. Usually credit cards, you're not really allowed to use credit cards for cannabis. So there's been some, you know, bills introduced. A bill passed the House last year, and the year before, the MORE Act. There is a Safe Banking Act in the Senate. So things could eventually pass, but I haven't, you know, it hasn't happened yet. And all we can say is they're not prosecuting people, and they're kind of stepping back on banks, but a lot of banks still won't do business with cannabis.
Yeah, and I'll give a shout out to Representative Nancy Mace in Congress, who's been trying to find a bipartisan solution to this with the States Reform Act. So you can always go to the AmericansForProsperity.org website and send your Congress person a letter of encouragement to support that bill. But one other issue there has to do with Second Amendment and the gun background check form that specifically singles out cannabis users. What's the status with that? I know that's been an argument from opponents here in New Hampshire.
Yeah, I find this to be one of the strangest arguments. Like, don't legalize cannabis because cannabis legal users can't own a federal gun. You can't own a gun under federal law. Like, that's still the case right now in New Hampshire. Anybody who uses cannabis and owns a gun is a federal criminal, and somehow penalizing people under the state law too is supposedly helping them. It's a very strange argument, but for gun users who use gun owners who use cannabis, there is some bright silver lining coming up. 2 different states, federal district courts in Oklahoma and Texas have ruled that that is a violation of the Second Amendment and that the federal government cannot prohibit cannabis users from owning or buying guns. These are just district court rulings, but they're rooted in a recent Second Amendment decision from the US Supreme Court, the Bruin decision. So that could be changing. And right now, people who are medical cannabis users might not want to be on a list as a cannabis consumer because they're afraid that somehow, even though it's a confidential list, they don't want to be on a list for doing something that makes it illegal for them to buy cannabis. And so by legalizing cannabis for adults, then people who use it medically and don't want to be on a list can just buy it over the counter.
Yeah, and I'll point out for HB 639, there is a specific, it was very intentional from the sponsors to make sure that there was a privacy protection where there isn't, you know, any keeping of the consumer's data. They have to check for ID, but they can't scan it. They can't keep that on file. So just wanted to point that out. We have about 15 minutes left here, so I want to, you know, try to address. I've been trying to address some of the questions I'm seeing come through online, but there's a few I didn't get, so I do want to sort of open it up to all the panelists and try to address some of these questions. So one of the questions is, with recent changes to federal laws regarding oral tests versus urine tests to keep the DOT laws intact, do you think this will assist with state opponents from using the argument that there's no way to test drivers for impairment? And open that up to whoever wants to take that one.
I'll take it. We dealt with that in Colorado as well because it's so much easier to take a test, you know, either breathalyzer or blood or maybe possibly urine test with regard to alcohol. And with cannabis, it's really an interesting thing because the presence of THC in the system, because it is stored in the fatty tissues, does not by itself indicate impairment. So one of the things that had to happen in Colorado is we had to introduce the drug recognition experts in law enforcement. And those are DREs, and those are individuals who are highly trained, and there are many other things, and I went and talked with them, and they talk about exactly what they're looking at. You know, they look at nystagmus, they look at a number of things that are not necessarily present with alcohol, but they are specifically present with cannabis if there is impairment. And so as a result, and there are, and one of the things that the state tax money has been used for has been to actually train these drug recognition experts. And many times if someone is stopped, they will call for a DRE, the DRE will come out, and they're pretty good. I mean, I would have to say they're really, really pretty good at that. You're going to have to invest in that. A state can't just ask their general local law enforcement to have that kind of expertise coming out the door. But if you invest in the kinds of experiences and expertises that you need, you can do it. And we've been successful in identifying that.
Thanks, Barb. I see a lot of comments around the scheduling, the federal scheduling of cannabis, and I'll open this up for everyone's comments of, you know, what do you think of cannabis being labeled as a Schedule I illicit substance? That means that there's no medical use whatsoever, and you know, how does that, from your perspective, you know, Rick or anyone else, you know, bring distrust to the governmental system, to law enforcement, and how does it, you know, it's sort of a spit in the face to medical patients right now. So I'd just like to sort of open that up to comment.
I can lead off just by talking about what it is that constitutes a Schedule I drug. There's actually a very specific definition for this, as defined in the Controlled Substances Act from the 1970s. It has to meet all three criteria. One is it has to have no accepted medical use. It has to have a high potential for misuse, and it has to have it must lack an established safety profile, right? So those are three different things. Cannabis fails on all three. We have established good, purposeful medical use for it. You know, if for no other group, just think of your aunt or your cousin or your grandmother who had cancer and couldn't eat, couldn't sleep, was nauseated all the time. What could you give them that would take care of this problem? Well, cannabis works very well. So there's just one use. So, okay, we failed on that one. High abuse for potential. Not to compare the addictions, because again, apples and oranges, but the addictive potential, the percentage of people who run into a problem with cannabis is about 9% of the people who try it. That's comparable to the same percentage of the number of people who would experience, for example, withdrawal from caffeine. It's about 9%. And the withdrawal from caffeine actually is far worse than the withdrawal from cannabis. But when you compare that to alcohol, which is something like 15%, cigarettes, something like 30%, it's much less addictive than these other things. The third one is no established safety profile. With all of the money that was pumped by the federal government into marijuana research over the past 80, 90 years, there's been a lot. Where did it go? It went into establishing the harms of marijuana. So we actually do know quite a bit about it. We know at-risk groups. We're limited by our inability to do prospective studies. That's the Schedule I status right there. But when you look at those three possibilities of what makes a Schedule I drug, it fails all of them. And, you know, people talk about, well, maybe we reschedule it then rather than deschedule it. Would you schedule alcohol? Because some people do use it for non-medical reasons, and it's simply impractical to make a medication or to make a substance like that illegal because it's so much a part of the culture. And so it goes with cannabis. So, and it would still limit our ability to do research if it was rescheduled. We need to deschedule it, and we need to regulate it for adults.
Excellent.
Can I also just...
Yeah,
sorry,
sure. Go ahead, Riley.
I was just going to add to that conversation about no approved medical value that we have 2 FDA-approved drugs that are from the cannabis plant. We have Epidiolex, which is CBD, that's been shown to be helpful for some forms of epilepsy. We also have Marinol, which is THC, that's been shown to be helpful for both cancer patients and HIV patients to help them stimulate their appetite and also for mental health. And just a reminder to everyone, yes, cannabis is still a Schedule I drug, and fentanyl is a Schedule II drug in the United States.
Yeah, thanks for pointing that out. And I just like a perspective from you, Riley, on, you know, since you're on TikTok, I am not. I'm a millennial, so I'm not quite there. But I you know, one of the things that we get all the time is how this is an issue that there's more of the younger generations that are more interested in using cannabis than alcohol, that this is a factor in where young professionals move. So I just want to get your perspective, since you have such a big following on TikTok, on how this might breed, you know, the prohibition of cannabis might breed distrust within younger generations if it were to continue.
Oh my gosh, it has already bred that distrust, and that's very obvious on social media. And by the way, I'm a millennial too. The reason I chose TikTok is just there's the opportunity to reach so many people, and my whole goal is harm reduction through education. So I chose to educate on TikTok just for that opportunity to talk to so many people. And every time I post a video, no matter what the subject, exactly what you're talking about happens. The comment section really turns into this like anti-government kind of mistrust in a lot of the authority figures, because there's so much evidence for the medical value, for harm reduction, and we don't see any changes made, even though this evidence just keeps piling up. And, you know, we're talking about alcohol. A lot of people don't want to continue micro poisoning themselves in party settings. They want to use substances that are shown to be safe, they're effective, and they are fun. They do improve your mental health. They make you more social. It is a social aspect to share a joint with your friends. And that's kind of what people are moving towards, because they can wake up the next day and they're not going to feel like they just, you know, poison themselves. They're going to still feel good. They're going to be a functioning member of society. They're going to go outside. They're going to go do something. And that's a lot more attractive than being in your bed, sweating and vomiting from the effects of alcohol consumption. So I think it's really awesome to see the next generation like really learning and really opening their eyes to saying, why are we doing this to ourselves? There's not like, we should probably stop doing this, and we should go towards more healthy alternatives. And of course, you don't need to smoke. You can take edibles, you can take tinctures, you can even use topicals for cannabis if you have some sort of, you know, chronic pain or arthritis or something of that nature. You don't need to smoke. But I mean, also, there's not a ton of data that smoking cannabis is that bad for you either, especially when you compare it to something like smoking tobacco, where that's a known carcinogen, where hundreds of molecules are entering our body that have the potential to cause cancer. So I love to see the younger generations. It really makes me happy. And I encourage you guys to get on TikTok, even though all the terrible stuff with legislation happening. It's still a very positive place, especially for learning.
Excellent. Well, thank you for all you do, Riley. And I want to go to Rick, because you know, one thing, and I've heard him testify multiple times, and I always love hearing his rebuttals to his colleagues in law enforcement who are on the other side. So I just want to hear your take on you know, why, you know, in your conversations with colleagues or former colleagues in law enforcement who are still vehemently opposed. What are some of the arguments you use to sort of try and get them to see the light on this?
Well, what's interesting is we really don't have to argue. I mean, I have a conversation with people, any police officer, one-on-one. We have a discussion, 5 or 10 minutes. I have them on board. Because you just can't object to what the facts are and what the truth is. And they finally say, yeah, well, I guess it's time. You know, we probably should. But the moment they leave that conversation and they get back in their routine, they join the pack mentality. And so there's this pack mentality among law enforcement of thinking in a certain way and embracing prohibition. And I can't tell you how many times that's happened, where I take somebody who's part of that pack, we have a conversation like we're having now. We talk about data, we talk about facts, perhaps even their history when they were in high school, to finally admit, yeah, really, it's, you know, we really probably should legalize marijuana. Okay, back to the pack, and it's inexplicable to me. And maybe it's this, you know, perhaps my dysfunction in 2007, some 16, 17, 18 years ago, when I was in active duty and I decided to join, you know, law enforcement action partnership and become an advocate for this, I didn't make any law enforcement friends. You know, there were a lot of people who thought, what's wrong with this guy? And I can tell you that between that day and this day, there are so many more law enforcement officers who've come over. Law Enforcement Action Partnership, our membership has grown. The amount of work that they're doing is phenomenal. And I think it's just a matter of time. But I just cannot express how disappointed and frustrated I am from the state that I've spent my life in, and how we're bogged down in this mud and on this merry-go-round. It's just so ridiculous to me, and it defies all logic. So I'm sorry for the long-winded answer, but there it is.
No, thank you so much, Rick. And again, thank you for what you and Leap are doing. It's so important. And to your point, I want to end on this since we're coming up on time. I saw a comment earlier from Representative Tom Mannion, who's one of the best in the House of Representatives here in New Hampshire. And this is probably for Karen as well. Is what can you do? Everyone's frustrated that this is happening, that we just can't seem to find a pathway to legalization. And as Tom pointed out, there's lots of single issue voters out there who consider this as their top issue, or maybe the only issue that they care about. Take your frustration and get active. Go call your senator tonight. Leave a message on their line in Concord, and just tell them that this is the time to legalize cannabis. It's so important to make your voice heard. It's what's been missing over the years, is just those voices, those 70% plus Granite Staters, to speak up and make their voice heard, so that action actually happens and we get the outcome we want to see. So thank you again so much to all the panelists. I don't know if anyone has some closing comments. Karen, if you wanted to say a couple words from MPP and close us out.
Thank you so much to everybody for sharing your wisdom. I wish that every senator would tune in, but we will send this to all of them to consider. Keep on keeping on, advocates in the state. Contact your legislators, as Ross said. Spread the word to others. There are so many states we've worked on where it has taken many years. In Delaware last year, the governor vetoed legalization. The House, who had voted to legalize, wouldn't override him, even though they had a supermajority. And then this year they passed it with a supermajority veto-proof margin, and he let it become law. So eventually popular will prevail, but you have to keep on pushing. You have to keep on mobilizing, and we will see the day when you're no longer an island of prohibition, but keep it up.
Thank you so much, everyone.